Hi, I'm Rabbi Adam Stein, and this is 5 Minutes of Torah with the BI Rabbi. I'm standing outside, as you can see, and I'm just across the street from our synagogue. And yes, that's the new Children's Hospital building there that opened a few years ago, maybe 5 years ago now. And I've often marveled at the fact that here we are, Congregation Beth Israel, and I've lived in 5 places here in Vancouver in only 7 years, but every place I've lived in has been a few blocks or a kilometer at most from BI. And I'm living and working within a kilometer of the most advanced and newest children's hospital, obviously in the province. It covers the Yukon. It's probably the most advanced west of, western in Canada, maybe the most advanced north of Stanford Children's Hospital in California. And here we are living so close to it, and I could get some of the best care in the world if I need to bring my kids here at any time. You might wait a couple hours, but I walk out after a day or two or 12 hours, no bill at all. There are families who come from all over BC and the Yukon territory and maybe further to get their kids, or themselves, if they are a kid, some of the best treatment money can buy. But it's the province, it's the community, it's the government, it's the people providing that care with money, not the parents paying bills. They might have to find an Airbnb or a VRBO or a hotel or friends to stay with if they're coming from far away, or maybe they get into Ronald McDonald's house and pay a tiny bit every day. Maybe Canucks place, I think, too. But isn't that amazing? And if you think about the cost and the people power and the energy and the time and the real dollars cost, it's certainly something to think about. I know there are lots of arguments about the waits that we have and the waiting lists, how much money goes into it. But believe me, it's a lot more of a mess down in the U.S. where I come from. I read an obituary yesterday about a man named Victor Fuchs. And I thought, oh, Victor, nice name. My beloved grandfather was Victor. We named my son Victor, his middle name, after my grandfather, Victor Fuchs. He just died in his late 90s. He was a professor at Stanford University for decades upon decades. For 70 years, he was a pioneer in the field of health policy research and really the economics of healthcare. And his most famous book, published in 1974, there's been required reading for doctors and health policy analysts ever since and never gone out of print. The title is Who Shall Live? Economics, Health, and Social Policy. I believe I got the subtitle correct. But the primary title I couldn't forget. Who shall live? And I thought to myself, now, it seems like an obvious question, who shall live? But who would think to title a book, Who Shall Live, except someone who had grown up as a child or maybe an adult listening to Unatana Tokef in shul services on Yom Kippur or Rosh Hashanah? How could it be any other way? The New York Times obituary and even the Stanford University obituary did not mention that Victor Fuchs was Jewish. An easy trip to Wikipedia in the first paragraph helped me find out that he was born to Jewish parents from Austria. There it is. I didn't get anything more, but I think when he wrote that book in 1974, he must have been thinking of that line. I have a teacher, Rabbi Blumen, was a student of hers as well, Reb Mimi Feigelson, and she talks about sometimes being in shul right after 9/11, 2001, just a couple days after, 2 or 3 days after, and she's looking around doing an Unatana Tokef. Who shall live and who shall die? Who by fire and who by water? And thousands of people had just died by fire in those Twin Towers in New York and the other 2 attacks. And she was just crying, and she couldn't believe, why isn't everyone crying? This year, I was looking at my prayer book and looking around and looking inside myself, thinking of those awful floods in Libya, more flooding today in Greece, the awful fires in Maui in BC. And it's important every day, whether we're in front of a hospital or just at home, to think about the cost of caring for people. And maybe cost shouldn't be a consideration, but of course, as Victor Fuchs taught us, it always is. and we try to care for as many people as we can. Shana Tova and Chag Sameach.